5, pull, 6, 7. We'll do one more here and then go to this area. Deep breath.
All right, we're here today with Martha, and Martha's about to start her treatment with Dr. Davis. So Martha, tell me about that knee pain that you've been having. How long have you had it?
Really off and on. It's gotten worse, but for about 20 years.
Wow.
Because I had an injury and I had a hurt leg and a hurt ankle. Everything happens to my right leg.
Wow. So you had an accident and you did some damage there?
Yeah.
Okay. Have you seen any other doctors for those knees?
I went to an orthopedist when I was having some swelling and some problems, and they did a MRI and a X-ray, and he gave me a prescription for Motrin.
Yeah.
Which I did not feel.
Right. I hear you. I'm with you. So what is this holding you back from doing? What is it that you enjoy doing that you can't because of those knees?
Well, if I go out with friends and we're eating, we all get up to go to our cars, I'm the last one to get up because I have a problem. And if I try to walk, I can walk, but not in just a little while. The knee just feels like it's going to give out on me.
So you feel weakness in that knee too.
And I told Dr. Davis, it hasn't happened lately, but I have had some, like I'd start to get up or get out of a car, and it's like the hinge won't work. And only once did I try to force it, and I almost passed out. So then after that, when it would happen, I just kind of dangle it till it clicks into place.
So it kind of locks up, and it won't let you bend?
It's all I can say is the hinge doesn't work.
We got to grease that hinge, right? Okay, so your discomfort level today that you were saying from 0 to 10 was?
3 to 4.
3 to 4 today? Okay. All right. I'm going to have you do a couple different exercises with me, and whenever you do it and you feel discomfort, I want you to point to where it's hurting. Okay? All right, Martha, can you stand up for me? Did you have any discomfort there?
No, right.
That was okay, going from sitting to standing? Okay, I'm going to have you take 2 steps forward. Okay, and I want your feet shoulder length apart. Arms straight out in front of you. And then I want you to keep your heels on the ground and squat down as low as you can.
I don't know if I can do this or not.
Well, if you just try to a little bit, there you go. And come back up. Where did you feel the discomfort there?
The right knee.
Okay, could you point to where it was hurting? Okay, right below that kneecap there. Okay, all right, Martha. I'm going to have you go up and down the stairs for me, and I want you to hold on to that railing. Look at the sunshine, and it's beautiful out here. Okay, so Martha, with going up and down the stairs, which was more difficult, going up or coming down?
Coming up.
Going up was more difficult for you? Okay. Out of all the exercises, would you say going up the stairs was the worst, or the squatting down?
Squatting.
That was causing you the most discomfort.
Yeah.
All right. Well, we're gonna go back and see Dr. Davis. We got to get you out with the girls, right?
Right.
All right.
5, pull, 6, 7. We'll do one more here and then go to this area. Deep breath and pull. 1, 2, 3, 4. Keep pulling all the way. 5, 6, 7. Good. Okay, deep breath and pull. 1, 2. There you go. Keep pulling. 3, 4, 5, 6, 7. Good. There you go. Good job. Good. 2, 4. Perfect. Good job. 2 more there. Okay. Pull your knee up. 1, 2, 3, 4, 5, 6, 7. Good. Deep breath. Pull. 1, 2, 3, 4, 5, 6, 7. Deep breath. Pull. 1, 2, 3, 4. Keep pulling. 5, 6, 7. About 80% effort. You don't have to go full strength. Relax it. Come down a little bit. Good. Okay, deep breath and press. 1, 2, 3, 4, 5, 6.
Okay, go down the hall.
Go walk down the end of the hallway and back for me if you could.
Feels better.
That's what I want to hear. How you feeling?
A lot better.
Less pain? What changes have you noticed?
I can move this right leg a whole lot better. Feels great.
Good. Let's go outside and try those stairs. All right, we're back with Martha. Martha's finished her first NSO with Dr. Davis. So Martha, can you stand up for me? Ta-da! All right, couple steps forward. Feet shoulder length apart. Arms out in front, and let's see you squat. Whoa!
Better.
Much better. All right, so now let's go up and down the stairs. Look at that. 1 foot per step. Do you see that?
Yeah.
Look at that. Oh, Martha, I'm so happy for you.
Oh, it feels so much better.
All right, Martha,
it
did you
stay
see
like
the
this?
stairs?
Will it stay like this?
Yes, it will. Yes, it will. What is your discomfort level? How much pain are you feeling? You were what, a 4?
Yeah. I'm not feeling any right now.
0? We haven't even done therapies yet. Are you happy?
Yes.
You ready to go out with the girls and have some lunch?
Yeah.
You'll be the first one out the door, right?
Right.
All right.